We live. Welcome to the Dr. AJ Macon podcast. Today we'll be talking about anxiety. Anxiety as general feeling of anxiousness, and anxiety as a mental health problem. Quite a lot of people might be suffering from this, and they don't know how to explain it due to the pandemic of COVID-19 and all other pressures that are coming from expectation and these new ways of doing things, the technological inventions and demands. And with me, I have Dr. Ajay Macon to discuss that with us. Doctor, welcome.
Hi, Reggie. Thanks for having me, and hello to everyone out there who's listening.
Thank you. Let's just start from the beginning. What is anxiety?
So, let's start in a different space. Particularly a saying by Mark Twain, and he says, "I'm an old man and have known a great many troubles, but most of them never happen." And I think that Mark Twain gave an interesting, if I could call it, a definition of anxiety. And anxiety is derived from the Greek word meaning to press tight or to strangle. And patients will describe where in anxiety they feel anxious, they feel like they're being strangled. And it's literally a continuous, often irrational feeling of arousal, discomfort, tension. And just patients will say it doesn't have a justifiable cause. They just feel it, even though there's no stress in their life. And it's a response to a threat that is generally unknown, internal, vague. Whereas fear is generally a known threat, an external threat you can see, a lion or some stress that's going to happen as a result of a particular issue we're facing in our lives. Nonetheless, anxiety is a normal human emotion that everyone experiences. Many people feel anxious or nervous when faced with a work problem or exam stress. In some situations, anxiety can even be essential to your survival. For example, if you're walking along a pavement or a footpath, a car serves in front of you. You immediately sense the danger, feel alarmed, jump back, and avoid the car. So this is a normal anxiety response called the fight or flight response, which prompts you to either flee or fight from the danger that you're facing. In most cases of normal anxiety, we can easily identify a cause as the stress, and reaction is reasonable and appropriate. Anxiety disorders, however, they're different. They cause distress. And it interferes with our ability to lead a normal life. In fact, there's a nice saying by the author Arthur Somers Roche, and he describes anxiety as a thin stream of fear trickling through the mind. If encouraged, it cuts a channel into which all other thoughts are drained. It becomes this negative vortex where we all literally are sucked into. He doesn't say that, but I'm just adding that.
So basically, I mean, I hear you mentioning that there is a difference between this feeling of like anxiousness, maybe due to whatever task we are faced with, and there's other experiences of anxiety that might be deemed to be clinical. And what are those? What is the distinction between the two? How can one tell that this is a clinical anxiety disorder, not a general feeling of anxiousness?
So anxiety disorders describe a number of common mental disorders, and they differ as what we could consider developmentally normal fear anxiety by being excessive, persistent, and beyond that appropriate age group. The symptoms persist across various situations, impacting on all aspects of an individual's life. And these can start in early childhood and tend to persist if not treated. And you'll find up to 1 in 4 people can have an anxiety disorder that needs treatment at some time in their life. And with more and more societal pressure, with the impact of COVID-19, as you mentioned, with the advent of technology, more and more of us feel anxious on a daily basis.
In your own professional experience and with all maybe potential clinical anxiety disorders, what are the common classification you came across that people do present with when they come to see you, maybe that can help us understand what classification or what forms of anxiety did a pandemic like COVID-19 bring up to the surface for people to actually be aware or suffer from?
So let me speak generally about anxiety disorders in terms of their subsets or groupings, classifications. So let's start with the one that generally presents when you're young. It's called separation anxiety disorder. And this is where an individual is fearful of being separated from what we'll call the attachment figure. And this is generally your mom, for example. And it's fine. We all get anxious when you're young to be separated from your mom. But at certain stages, it can be what we'll call developmentally inappropriate. And the young child will present with constant fear or of harm or separation from that significant attachment figure. Example, when a child refuses to separate from mom and go to school. And generally over the years, I've seen it in terms of examples where a young child might have been separated for various reasons, be it mom had to go to work for long periods of time and be away from the child for extended periods. And on the return of mom, the child will get anxious about the fact that mom might leave again. And perchance they have to go to school, will feel very anxious because they're concerned that if they leave for school again, mom will not be there when they get back home. So that would be one example of a separation anxiety disorder. Another common one I've seen in my practice, not too common but significant, is what we'll call selective mutism. And this is difficulty to speak in social settings in which you're expected to speak. Example, at school, even though the individual might speak in other situations. And this behavior will tend to affect at various aspects the person's life. So we'll find someone who generally doesn't come straight to me, interestingly enough. Over the years, they'll be referred to the ENT surgeon or the neurologist because they have difficulty speaking. And the neurologist or the ENT surgeon will not find any physical, organic cause as to their mutism where they cannot speak. And as much as they try and get the history from the patient or the family, they find that the patient has been going through excessive stress. And you find sometimes that the patient's voice will return under certain situations, suggesting as well it may not be what we'll call physical in nature, but more mental and emotional. And then when I interview the patient, you'll find them going through extreme stress, maybe a broken relationship with a significant other, work challenges, and slowly as they gain insight into their condition or understanding or coping skills, the mutism, the abilities to speak returns. The one that we most commonly know from an anxiety perspective or we hear about is what we'll call a specific phobia, where we all have anxiety or fearfulness of a particular object or situation. And it may be specific to an animal, insects, heights, seeing blood, injections, confined spaces. In fact, one that's common during this COVID-19 pandemic is patients describing having to get the COVID swab done, the nasal swab, which is thrusted right into the back of your nostril. And, I've had it a few times and you're like, whoa, this is hectic. And some patients deliberately told me where they avoid having nasal swabs, they prefer having oral swabs. Yes, one might debate which one is more effective, but they deliberately will try to avoid these nasal swabs because it's quite traumatic and painful.
Yeah.
In fact, the word phobia is derived from an interesting Greek word called phobos, which was the Greek god who provoked panic and flight in his enemies. So sometimes I guess even having these nasal swabs during COVID pandemic is like wanting to flee from your enemy. So we know social phobia, at least specific phobias, quite well. Another type of anxiety category is called social anxiety disorder. And this also is very common, where patients will describe fear or anxiety or avoidance of social interactions and situations that involve the possibility they feel of being scrutinized, humiliated. Examples is having a conversations, meeting unfamiliar people, eating, public speaking, etc. Patients will tell me they have difficulty, that you can do their work, but put them in the boardroom surrounded by people, they really, really struggle. Or being in a social setting, they feel they've got nothing to add and they get very anxious to be on one-on-many situations. They can handle maybe the one-on-ones, but being in a group is really tough. Another one is panic disorders, and this is where patients experience recurrent panic attacks. and are persistently concerned of having another panic attack, and develops into maladaptive behavior, and they as resort to avoiding these panic attacks. And it's a panic attack is a sudden intense feeling of terror and occur in any situation for no apparent reason. You can get short of breath, dizzy, rapid heartbeat, palpitations, choking, nausea, sweating, tremors, and people literally describe they feel they're going crazy, they're having a heart attack. I've had patients described where they've had to pull over on the side of a road, open the windows, thinking they're going to have a heart attack. And these are patients that generally are referred from the emergency casualties of hospitals, where they've been brought in, they're complaining of a heart attack or some extreme symptoms. The casualty doctor runs the whole host of tests, ECGs, sometimes extensive and intensive invasive investigations, comes back absolutely normal. They do a history of what the patient may be going through, and they find that the patient has been going through extreme stress, be it at work, with family, or whatever the situation is. And that's when they get referred to me. In fact, the word pan means is the originator, the Greek god again, or the originator of sudden and unexplainable terror. And a couple more, agoraphobia, where we develop fear or anxiety of certain environmental situations, fear of not being able to escape, or help not being available in events of having a panic attack. And this is where we may avoid, and we see it again quite commonly, public transport. Being in crowded malls, that's a very common one in this day and age. And to the point where we're even afraid to leave the home because of the fact that we concern about crowded places and where we'll engage with people in an environment that makes us all stressed out. And then we get generalized anxiety disorder, and this is where you have excessive anxiety or worry about almost everything, including work, finances, school. We find it difficult to control the worry, and it's often accompanied by physical symptoms, headaches, neck spasms. We'll describe our minds as going blank and insomnia. So these are a few of the range of anxiety disorders, and it's characterized by, as I said, this persistent, unreasonable fear, and about be it even a general or even a specific event. But if they left untreated, it can actually, anxiety disorders can lead to depression or other physical and psychological problems. But as I've said in the past, all these problems can be treated. But it's important to note, though, that there are many medical diseases, alcohol and substances, that can cause anxiety-like symptoms. And these underlying causes, need to be treated first. And what you find is then the anxiety subsides. However, if the anxiety does not subside, of course, that also needs to be treated. There are other conditions that used to be incorporated within the anxiety spectrum, or anxiety disorders, like we know of obsessive compulsive disorders, post-traumatic stress disorders. But according to the American classifications, which we tend to use in South Africa, since 2013, they've been put into a separate category. So I hope in some ways I've helped explain these various classifications.
And I must say that just from my own personal experience, I have, I think, specific anxiety disorder, because when I went for that COVID swab, I had to say to the doctor that if you hurt me, I'm going to just lift you. And she kept saying, "No, you're a big dude. Come on now, just take it." And that swab is like long, and I was like, "My good." And injections too. I don't like injections, so I can understand how. I have a personal kind of experience on that. But then, and you have mentioned quite a couple, and I think even parents can relate, or maybe parents who don't know why the children are like crying so hard. Because at times when you're passing by, you see a child screaming, not wanting to go to crutch, and parents just brush it off and just leave them there. And that might be presenting as like separation anxiety that needs professionals like you to help the parents wean the child rather off or rather comfortably, just get them through that experience. And with that being the case, why do this happen? I think that's the big question. What causes anxiety disorders?
So it's interesting, we don't necessarily know the precise causes of anxiety disorders, but there's various factors, various reasons, may I say, that will contribute to anxiety. What's interesting, it could be what we'll call a learned response over time. So, such as learning to fear something after having seen others being fearful of it, that's something we tend to do. So we assume, if a lion came in, I'd assume both of us would be fearful of the lion because we learned that's the learned response. If a dog comes in, we'd probably maybe a bit more comfortable, but interestingly enough, the lion might be the tame one, the dog might be the dangerous one. Yet we learn how to deal with things, and some things naturally or automatically evoke fear. So, and we assume that's how we need to react in a particular situation. So we can actually teach people to be anxious. So growing up in an environment where people are generally anxious definitely contributes. The other thing is personality types. Some people are just naturally more anxious. You find different children, if you have kids or siblings, react differently. Some of us will be quite comfortable to go and pet a lion. In South Africa, you have that opportunity. Some might say, be it right or wrong, where some people will never go near one, or a snake, or for that matter, insect. Stressful, traumatic life events predispose us to anxiety because we recognize that it's stressing, provoking, and over time we become more and more anxious. Scientifically, we know a family history of anxiety disorders predisposes us to anxiety. And there could be various issues which we may have faced as a child growing up that makes us more anxious. And people will describe certain events, trauma that they underwent as a child that makes them more anxious. A very important one is alcohol, medication, or illicit substances. And of late, I'd like to elaborate on that, because substances, alcohol, as much as they seem to sedate and calm you in that one moment, the very next moment you are edgy, irritable, more anxious. And one of late that we're seeing more of in the South African setting is the use of cannabis. Now that it's been, to some extent, legalized, it seems, in terms
for private use.
For private use, one has to understand the laws around that completely. Is that so? There's a societal acceptance of the use of it to kind of calm you down, relax you. Yet, cannabis does come with its own side effects of mood swings, irritability, maybe because of the withdrawals from it or the excessive use of it. So these are some of the things we're seeing more so. And yes, other medical and psychiatric problems can predispose to anxiety. So yes, equally important may be also the person's general level of anxiety, beliefs and attitudes that we hold about ourselves, and how the world should be. Watching politicians on television can provoke anxiety in some of us, given what they might say or what they might do or not do. And that can be anxiety provoking. And these problems can begin in early adulthood and can be triggered by events as we go along in life. And life experiences that are traumatic appear to trigger anxiety in people who are already predisposed to anxiety or prone to anxiety, where some others may not be. And also inherited traits may also be a factor that predisposes to anxiety.
And what are the symptoms? I do think that one can relate with general feeling of being anxious. And what are those common, or rather symptoms of various clinical anxiety disorders.
So, what one patient may present with may be very different to what another patient presents with. Some patients may experience a fearful anticipation with, muscles getting tense. In fact, that's why we might complain of backache, because our muscles are on edge and tense all the time. Irritability and sleep disturbances are something patients will describe. We're more sensitive, be it to noise, to various stimuli, and we are more restless, edgy, irritable. We worry constantly. Our mind is working overtime, and we have difficulty concentrating, focusing. We completely distractible. Our memory is not as good as it used to be because the mind is so preoccupied with these various worrisome thoughts. At its extreme, you can feel tightness of chest, palpitations, tingling, and people will describe like butterflies in their stomach. At its extreme, they'll complain of pain in their tummy and find that it is one of the causes might be acid reflux. We can even feel breathless, dizzy, sweating, racing heart, dry mouth, chills or hot flushes. We might feel like we're choking, nauseous, upset tummy, pins and needles of the hands. And we feel like we're going to lose control. We might die. And we feel we're having heart attack, as I described previously, amongst other medical conditions. We, at times, after a chronic state of anxiety, we'll feel tired, headaches, loss of appetite, constipation, or even diarrhea. So we will avoid then those situations that cause the stress, and we will then be terrified of social contact. We'll recognize, geez, we cannot go there anymore. And even to the point, as I said earlier, we won't leave home because just leaving the front door is anxiety provoking. I had a patient who would get out of his house, get into his car, drive, and then have to come back home because he just couldn't manage being out there. And the patient recognizes that their fears are irrational and excessive, but they just seem to not to be able to do anything about it. And when they come for treatment, they say to me, I know my fears are unreasonable, but I just can't seem to stop them.
With that being the case, obviously one would like to know how they can treat that as a mental health condition. What are treatments one can kind of go for, and obviously I believe they will be classified or rather differentiated on the basis of whatever anxiety category one is suffering from.
So, when a patient comes to you with complaining of anxiety, we need to do a proper, complete medical assessment because it's very important to exclude underlying medical causes. Someone saying having a heart attack, it's not anxiety. Until otherwise proved, as we might say it, we need to exclude the heart attack, and then and all other medical conditions before we just assume it's anxiety. And you can start by seeing a healthcare worker, and they will assess you and see what's going on to find out whether your anxiety is related to your physical health, right? And it's very important to check for the signs or symptoms of a medical condition that may need treatment. Once the medical reasons, the physiological reasons are ruled out, then it would be important to see a mental health care worker for diagnosis and treatment. And even there, a mental health care worker will exclude further, ensuring there's no physical cause that might be predisposing. Once the anxiety disorder is diagnosed, then there's treatment again would be along the lines of medication together with psychological treatment. Psychological treatment can include relaxation training, meditation, biofeedback, stress management, various coping skills, tools to deal with it. One of the most effective forms of psychological treatment is cognitive behavioral therapy, for example. And that's regarded generally as the first choice treatment for anxiety disorders. Through that technique, patients identify, question, and correct their tendencies to maybe overestimate the danger and have the ability then to cope with the danger, not recognizing it as being unable to, but rather they have the capacity to. And they recognize that their thoughts, attitudes, or beliefs that they may have is actually causing that anxious state. So these distortions, as we may call it in thinking, are identified and actually restructured. So it leads to modifications in behavior which alleviates the anxiety. There are other treatments, and we do use medication. You know, patients suffering from panic attacks may be helped by what we'll call tranquilizers, antidepressants. And there are now other class of medications which are now being used. Very important about tranquilizers, they only prescribed in specific cases and to control the unpleasant side effects or symptoms of anxiety because of the maybe palpitations, sweating. And once you settle that, we tend to avoid tranquilizers being used long term because they have their own potential side effects in the if used chronically. The other thing we do is educational and psychological therapy. And there's, as I described, there's a wide range of psychological therapies for anxiety that can help you control your arousal states and manage your panic attacks. And these help you understand your thoughts, your emotions, your behavior, and gives you new ways to deal with anxiety. And also counseling can help you deal with stopping drugs, alcohol, resolve life stresses, and developing better skills. And you help to learn to deal with conflict, for example, manage your life better. And there's nowadays, in fact, tons of self-help books dealing with creating time, deciding what's important. You know, one book is called "Don't Sweat the Small Stuff." You know, and amongst various ways that we are now trying to learn to deal with these things, and avoiding family conflict, for example, developing ways of using the seeing the family as a means of support and encouragement rather than just creating conflict. And there's what we in the past was seen more as alternative, but is getting more acceptance as mainstream, is meditation, mindfulness, muscle relaxation, breathing exercises, reading, yoga, daily exercise. I mean, this releases the feel-good hormones and naturally uplifts hormones called endorphins. Talking about your worries with someone you trust, you know, that's as we say, getting it off your chest also helps. Very important, finding the balance, be it between your work, your hobbies, your family and social life, and remove factors that cause stress. And I must say, in this day and age, very important is social media. I'll have patients coming to me in a very aggravated state, and we try to identify the sources of stress, and we find that they're spending hours on various social media platforms, watching gruesome videos, watching the crime channels on TV, and you have to tell them you have to avoid these things. Even watching news on a daily basis, some patients are, I would call it like news addicts, where they on the hour getting updates of the latest accidents, the latest carnage in the world, and that just creates a subtle, or even at some point then overt anxiety in your body. Other techniques, as I said, learning deep breathing to help you deal with the panic attack. In fact, it reminds me of when I worked in the as a doctor in the military. These young soldiers would come in or having a panic attack, and they'd be lying there and they'll have such extreme panic attacks that their bodies will literally go into spasm. And we'd hold a brown paper bag over their head, over their nose and mouth, so they'd breathe. And it's a practice where they literally breathe in the CO2 and it settles them down. And fundamentally, it will be telling them, breathe calmly, breathe slowly, because they'd be hyperventilating when they came in. And we'd get them to settle down and calm down merely by controlling their breathing. Also, importantly, eating healthily. You know, we eat junk food full of sugar, full of oils that get us all hyped up and doesn't keep us calm, cool, settled all day. avoiding substances, as much as they seem to help with the anxiety, be it alcohol or cigarettes, they make us irritable and anxious the next moment when we don't have it there. One that we also have to be careful of is avoiding excessive caffeine intake, be it in the form of energy drinks or coffee or tea, because that also is a stimulant that heightens our physical body's systems in terms of being more sensitive to environments. Things like also developing good sleep patterns, going to bed at a certain time, getting up at a certain time. We have routine and structure in our day. And other, what is seen nowadays as mental health techniques, building self-esteem, confidence, having an optimistic outlook, or I would say a more realistic outlook on life. So those are some of them, and there's more and more that we're discovering as ways to assist us in helping us alleviate our anxiety.
It seems the symptoms of anxiety are really debilitating and really daunting to many people. And I must say that the people listening at the moment, they should seek help when they're experiencing these things, because it sounds to me that with all the pressure, the social pressures, these are common kind of, you talked about something around sleep patterns. Nowadays, it's difficult. Post-COVID, you'll find people in the middle of the night still up because they've been home for so long and their sleep patterns are completely out of control. And all the expectation that are put on people, expectation at work, expectation from your significant others, can create quite an experience that causes this experience of anxiety disorder. What are the last things that you're wanting to say, or rather to advise people on anxiety as a mental health problem?
So it's definitely a growing problem. Seeing it more and more during COVID, people nowadays, we try to control situations, circumstances, beyond that, the people in our lives. And because we lack that control, we get more and more anxious. We have, in fact, during this COVID pandemic, one thing it showed us is that we can't control the situation. And that's, in fact, if anything, makes us even more anxious because we have no clue when we go out there whether we're going to contract the virus or not. So we're seeing it more and more, and it's debilitating to a level, because some people literally do not leave their houses during this COVID pandemic, justifiably so. But one wonders to what extent it's because of this anxiety that it's evoking. But I must say that it's important to recognize with anxiety that there is hope, that there is faith, even, and this is very important, because even though your brain is telling you there isn't, your brain will logically and rationally say there's no way out. But you got to look beyond your brain, the limits of your mind, to recognize there is hope. You just got to, it means having hope beyond your mind, breaking out of the bubble, and you won't see it. You literally sometimes may have to be led by the hand to recognize, wait a minute, there is hope beyond this brain. And also very important, we spoke of optimism and pessimism to some extent, but it doesn't mean you have to be optimistic all the time. It's perfectly okay to feel sad, sometimes angry, one would argue, annoyed, frustrated, scared, or anxious. Those are common emotions, or not common, but normal human emotions to feel. Because it can't be, I'm sure all of us, definitely myself, if we're standing prepared to do our first skydive at the end, at the door of a plane, you can't say, I will not feel fear or anxiety. You will feel those things. It's normal as we grow as human beings to explore beyond our current world, that we feel these things. And having these feelings don't make you a negative person. In fact, if anything, it makes you and I both human. And it's, in the past, the world was about, if you go back to the time of Christopher Columbus or so-called explorers, they broke through physical boundaries, as in explored new worlds. Now your world is about the mental world that you're trying to break through. And you're going to experience appropriate fear or anxiety rather than anxiety that just stems from trying to control situations. We let situations be, and we need to learn to control our minds. One thing also that I must say is it's also important, in spite of all that you feel, the anxiety, that completely gets you down, is never give up on yourself. It does get better once you seek help, be it from medical professionals, or even your loved ones. You know, and I've seen patients thrive in their lives with anxiety and improve, be it with medication. You know, patients who've struggled to drive for years have had family to pick them up from home, come to work, drop them off, go back home, come back in the evenings. And it's beautiful to hear. They'll come back to you a month later, doctor, I'm driving on my own. And those are the small wins that make a difference, given they've been living with anxiety. Or another patient who's cannot speak in the boardroom at all. And with psychotherapy, with medication, he's made a fundamental difference. So yes, if you're stuck in that anxious, small, negative situation you find yourself in, when I say small, as in you feel small in that space, seek the medical help, seek the professional help, and you too can then thrive in this game called life.
Doctor, thank you so much. This has been a very insightful episode for maybe people who are out there and not feeling quite well with regard to maybe the feeling, or rather experiencing, anxiety disorder. Really, thank you for your expertise.
Thank you, Reggie. Speak soon.